Good morning, everybody, and thank you very much for joining us today. My name is Senator Susan Eggman. I represent Senate District 5, which is San Joaquin County, a little bit of Stanislaus and Sacramento. And joining with me today here, I have the Coalition of Big City Mayors. With us today is Mayor from Riverside, Fresno, San Diego, San Francisco, and Sacramento. And before we go any further, I just want to, if we can all just take a pause in acknowledgement of the horrible shooting incident that occurred in Sacramento early yesterday morning, and to remember those whose lives were lost. Thank you all very much. It seems like tragedy strikes our cities more and more. A little more than 2 years ago, even before the pandemic, I don't think anybody would argue that the biggest problems facing communities throughout our state were the twin crisis of homelessness and serious mental health issues within the larger homeless population. These are related issues. We understand they're discrete, but the crisis of the place to live and a lack of access to appropriate care is acute and felt severely on our city streets. The pandemic has only made these problems worse. But one of the silver linings, I think, coming out of the pandemic is the state's surplus of budget that gives us real opportunities to tackle these issues at a much more holistic and comprehensive way. Substantial state investments in housing, behavioral health infrastructure, and behavioral health care services are a hallmark of the current state budget. And I expect when we get ready to pass this next budget, will be infused yet again. Real and meaningful and lasting change requires a sustained financial commitment to these issues, but even more is needed. We must fix our broken and fragmented behavioral health care system. If you think about it, the LPS law that governs our mental health system and our continuum of care was passed in 1967. 1967. You think about it, I think I was in third grade in 1967, and Lord knows I'm a lot older than that now. And I was thinking about, like, in my house, the only thing that I still have that works from 1967 is probably my 1954 Wedgwood oven. And we know we're trying to help people, and we have to be able to update our systems that are there to make sure that the safety net exists. And sometimes it feels like we have taken such care to make sure our safety nets themselves don't hurt people, that we've left gaping holes that people fall through, damaging not only themselves, their families, but our communities and our streets. And so we have to take a real holistic way in being able to address it. And we have to have the courage to be able to look at a broken system that, again, built in 1967 with a huge promise of that we're going to stop institutionalizing people and we're going to make a community care system. We never followed through on that promise. We stopped institutionalizing people, but we never provided the care and resources that people need to live safely on the streets, and for mayors, boards of supervisors, to be able to look their constituents in the eye and saying we're doing everything we can, and knowing that the system is there to help them and not hinder and tie their hands so they can't do the work that is so needed and that they want to do on our streets. So I'm honored to be joined here today with the Big City Mayors Coalition and two of our state psychiatric associations to announce a package of bills that will modernize our state's continuum of care. These bills are intended to improve our existing behavioral health care system across the continuum for prevention and early intervention, community support, services, intersystem collaboration, improving access to assisted outpatient treatment, providing increased accountability through outcome tracking, preventing avoidable conservatorships, and improving the effectiveness of our conservatorship process for those that need them. In the interest of time, people have heard me talk a lot about my 8-bill package, and I can go on forever, but I will just focus on a few today. Senate Bill 965 will better ensure that a person's behavioral health history will be taken into account when a judge, is making a conservatorship determination. Right now, if somebody has reached the end where they're perhaps ready for conservatorship, they go before the judge and they say, here's my plan, or somebody announces it for them. Based on that plan, the judge has to make a decision without taking into account if that person has presented with that same plan 50 times before and has not been able to follow through with it. This will just allow history to be taken into account, located in their medical records. We continue to see that struggle of people getting almost to the end and then cycling right back through that very system again. And we know that's our hospitals, our shelters, our jails that feel the brunt, and our streets that feel the brunt of people falling through our system. The next one I want to talk about is SB 970 provides, working with the Steinberg Institute, an update to the MHSA, or the Mental Health Services Act. The MHSA has provided a dedicated source of funding for community-based behavioral health system for over 15 years and resulted in many Californians getting the help that they desperately need. But we've learned a lot in 15 years. And so we're going to make updates to that. We're not going to wait. We're not going to wait 40, 50 years. We're going to do it at 15 years. This bill builds on the current law and emphasizes a more outcome-based and accountability-based approach with frequent reporting to increase transparency so we can actually see the resources attached to the outcomes that we're hoping for. SB 1227 establishes an additional tool for behavioral health care professionals to stabilize a person short of pursuing a conservatorship. Current law allows for a person gravely disabled by mental illness to receive 30 days of intensive treatment to reduce the need for an additional conservatorship. This bill would allow for a single 30-day extension of that existing program, give them another 30 days perhaps to stabilize before they move into a conservatorship. SB 1416 would modernize the definition of gravely disabled within the LPS, or the act that was passed in 1967, to more acutely provide for the needs faced by individuals experiencing severe and chronic mental illness. This bill would include within the definition of gravely disabled a condition in which a person, as a result of a mental disorder, is unable to provide for the basic needs of personal and medical care or self-protection and safety. It seems like common sense, but this is what we're trying to update our laws to reflect, not just food, clothing, and shelter, but the actual ability to provide so they're not victimized on the street and be able to provide for their actual care and safety. Most other states in the nation allow for this, and this is how they've interpreted the law. We have it interpreted much more narrow, and we want to be able to expand that so we can actually help people that so desperately need it. In recent years, we've picked up this issue with important but siloed reforms. This package of bills and other proposals working through the legislature, that I'm sure you've heard some about, will take a more holistic view of our system. Again, there's a few bills out of the 8-bill package, again, really intended to look from the beginning when someone needs some help with the MHSA all the way to the very end, and to try to modernize our laws and our care system as we pump in billions of dollars of investment that we have not had the opportunity to do in decades. So at this time, I would like to provide the mayors an opportunity to share their perspectives, followed by remarks from our two world-class psychiatrists that I'm honored to have with us today. It's my pleasure to turn over to my friend, my former colleague here in the legislature, San Diego Mayor Todd Gloria.
Thank you so much, Senator, and good morning, everyone. As mentioned, I'm San Diego Mayor Todd Gloria, and I'm honored to be here with several of my fellow mayors in strong support of Senator Eggman's bills that look to tackle one of California's most critical issues, that of behavioral health. Right at the top, I want to acknowledge and thank our chair, Oakland Mayor Libby Schaaf. Her schedule did not permit her to join us this morning, but she's helped rally the mayors, the 13 largest cities in California, together to stand side by side with Senator Eggman in support of this legislation. And I would say that having the 5 of us who are here, I think, is a testament to how important this issue is to mayors. We happen to represent the largest cities in California, but I think if you threw open the Zoom to every mayor who had this as a priority concern, I suspect we would shut down the website. This is a major issue, and I thank Senator Eggman for her leadership on this. I've made it my mission this year to work with my fellow mayors and former colleagues in the state legislature to reform California's conservatorship laws. I want to just point out right from the outset that it's time that we face the obvious but painful truth, which is that our behavioral health system in California is broken, and now is the time to fix it. For far too long, all of us all of us have been complacent in allowing the extremely mentally ill and folks who are deep in substance use to languish on our streets, cycling between our jails and our emergency rooms with little hope of getting the care that they need until they get to the most acute of crisis that invariably costs the taxpayers a tremendous amount of money and leaves our streets in the state of repair that they currently find themselves in up and down the state. This is not a Northern or Southern California, not a coastal or interior issue. All of us are seeing this. All of us are dealing with this. And this is why we were all here this morning. I want to point out that traditionally this seems to have been a state and county issue. The state sets out the rules, the counties get the cash, and they work on these issues, and cities maybe were not so deeply engaged. I think we want to use this opportunity this morning to indicate how much the cities of California are engaged in this issue. That's why so many of the mayors are here today. Last year in the city of San Diego, our paramedics, our firefighters, and our police officers spent nearly 400 service hours each day responding to behavioral health emergency calls from people in crisis. 400 service hours a day amongst our public safety professionals. That is a part of why we're here today and why we're so supportive of what Senator Eggman is trying to do. And let me just say what I know you're all probably thinking. This is tough stuff. These are sensitive issues. This is hard work. But that hard work is not an excuse not to do anything. Quite the opposite. This is time to engage. And I'm grateful that Senator Eggman is not shying away from reforming a 1960s era set of legislation. It is time to update this to match what we're seeing on our streets, a combination of wealth disparity, rising unaffordability of housing, and the injection of opioids and other kinds of drugs that have made this issue that was already bad when the legislature took this up in the 60s, but have made it infinitely worse. And a part of why urgency is a part of the call today. Senator Eggman is taking this on in a comprehensive way. She mentioned a multitude of bills, and I think that's reflective of the complexity of this situation. While I'm focused particularly on homelessness, I recognize this touches all parts of our mental health system. But what I often say to folks, homelessness is a complex problem, and there's not a simple solution to it. And Senator Eggman reflects that complexity with 8 bills, as she mentioned. Now, this is on top of Governor Newsom's proposal for care courts, which I think also is an important part of this comprehensive solution, trying to engage with individuals before they get to the point of conservatorship. And as you heard from the senator, also trying to engage before people get to this position, but then actually implementing kinds of protections around data collection, accountability, local accountability. I hold myself unwilling to be held accountable if given additional tools and resources to address this issue. I suspect most of my colleagues here feel the same way. So whether it's Senate Bill 965 or Senate Bill 1416 that really engage on this issue of conservatorship. Listen, I want to be clear. I care deeply about civil liberties. I care deeply about, engaging on this issue with compassion. But no one can look at what's happening on the streets of California today and suggest that this is compassionate. It is the opposite. And that is why we're so passionate about trying to do something this year. So, Senator Eggman, thank you again for working with the mayors to present this comprehensive, thoughtful, compassionate group of bills for your colleagues' consideration. I hope that we can work with stakeholders to improve and perfect these bills. And I'm hopeful that we can work with the legislature and with the governor to get them signed into law this year. It is urgent. The situation on the streets is bad. And the average Californian looks at this and wonders what the heck is going on. And does anyone know that this is a problem? We know it's a problem. We have solutions that we can advance. Now is the time to do them. With those comments, it gives me great pleasure and it's an honor to turn over the virtual podium, if you will, to my colleague from the city and county of San Francisco, Mayor London Breed.
Thank you, Mayor Gloria, and I truly appreciate both the remarks of you as well as Senator Eggman. Thank you for your continued work and leadership in advocating for behavioral health reform in this state. And I hope that your colleagues share your passion and excitement for what we know we can do. This package of bills is a strong set of reforms that our state very much needs, and something that I've been talking about on a regular basis in San Francisco. It has been quite frustrating. I am truly committed to helping those struggling with mental illness and addiction who are unable to care for themselves. And I've been advocating for statewide conservatorship reform since 2018. San Francisco has invested millions to support this population, but unfortunately, the current tools we have are just not working. We are a city that leads with compassion, But what we are allowing to happen, as Mayor Gloria stated right now, is far from compassionate. It is too many on our streets, and it is really a disgrace. We see people every day who are in crisis. In fact, there were a number of people that I was working with personally with our Department of Public Health to try and help to find them right back on the streets after we've gotten them into resources and programs. These people, they have families and friends who want to take care of them. They are people's brothers and sisters and daughters and sons. And it's not only about those on the streets in crisis who are not accepting help, it's also about those who are unable to accept help. People who have schizophrenia, people who suffer from dementia. It's about those who are unable to make decisions for themselves. It's about those who we are unable to help because we won't make the necessary changes to our laws. A gentleman that I've known for many, many years developed dementia over a number of years. He started to get a little violent, confused, and eventually he lost his housing. He's homeless to this day on the streets. When I see individuals like him, I get frustrated that we can't do more. And I think that if we were out there in that same condition, I would want someone to step in to do something, no question. We have tried creating different programs to address the gaps in the original conservatorship programs established over 50 years ago. We've implemented programs like our assistant outpatient treatment and housing conservatorship, and still people are suffering. There are large unacceptable gaps in this existing resource. Voluntarily programs and those with impossible high qualification requirements are not doing enough. They're barely scratching the surface. We're leaving people behind. People are incapable of getting the medical and personal care they need and the dignity they deserve. We must go back to the basics, the most powerful process we have. That's why it's time to improve our conservatorship laws and to bring them up to date with our current technology and to better address our current crisis. Every city and every county, we're all struggling, and those laws are truly outdated. We need these tools at our disposal, and we need to this update to happen on a broad, consistent, and unified state level. Mental health conservatorship can and needs to be a stronger method to help ensure that all San Franciscans and all Californians are given the help they need so they have the proper medical care and support. The bills that are being introduced by Senator Eggman will address the inefficiencies in our systems by gathering and analyzing data regarding outcomes and waiting periods, speed up access to beds, which we've expanded significant numbers of behavioral health beds here in our city, and it reduce the barriers and delays to receiving necessary care by creating a bed registry, and provide better care to those that are suffering by requiring that patient history has to be considered by judges and by clarifying when medications can be ordered by the courts. The ultimate goal is for every person to be healthy, to be safe, to be happy, to live in dignity. These bills allow us to get one step closer to achieving that for everyone, and especially for those who are unable to achieve that goal on their own. I know the governor cares about what's happening in our cities, and I'm hopeful that he will support this package of behavioral health bills into law. Thank you, Senator Eggman, for being a leader in addressing the mental health and addiction challenges that we are facing in our state. From these bills to your work on overdose prevention programs, you have been there helping to strengthen our laws and move forward innovative solutions that will truly make the difference in people's lives. Because these problems aren't just going to go away because we don't want to see it. We got to make some action happen. I'd also like to thank my fellow mayors from the Big City Mayors Coalition and everyone in attendance today for your work and advocacy. And now I'd like to turn it over to the mayor of Fresno, Mayor Jerry Dwyer.
Thank you very much. Jerry Dyer, City of Fresno. And I want to first say thank you to all of my fellow mayors for being on this call today. I know some could not make it, but this is one thing that the big city mayors, the 13 big city mayors, 100% agree on, and that is supporting Senator Eggman's package of bills that she is bringing forth. And It is refreshing to see someone bring forth bills in such a thoughtful manner and have the expertise and the foundation for being able to bring these bills forward. I do believe they are needed for today, based on what we're facing in society. And I know firsthand the impact on mental health in communities, on families and neighborhoods. After spending 40 years in law enforcement, last 18 as a police chief, being able to see the number of families that have been impacted and frustrated with our lack of response from our current mental health systems. And I've also got to see the impact when we don't deal with individuals in the right way. Oftentimes they end up in our criminal justice system where they do not belong. In fact, our largest mental health facilities in the state of California are our jails. And that is a sad state because that's not where they belong. Mental health is a major driver of our homeless population throughout the state of California. And although we're having a lot of success thanks to Home Key and a number of other successful state money funding that is being provided to us, and we're housing folks, we're providing services to many of the homeless individuals that are out there. The reality is there's still a percentage of folks that just simply will not accept services and housing. They're not capable of accepting those services. Their mental state does not allow them to make a good decision for themselves. Each and every day, our police officers go out there and deal with mental health calls in abundance. In fact, we average 15 committals a day under Welfare Institution Code 5150, where people are not able to care for themselves. They're a danger to themselves, danger to others. That's a lot of resources that we're committing and recycling. Many of those folks are recycling through our criminal justice system, recycling through our medical system. And it is time that we fix our broken mental health, behavioral health systems in the state of California. We need much better coordination, much better care, and we need to be able to communicate with each other regarding this. And there has to be a complete revamping of our current conservatorship model. And I believe these packages of bills do that very thing. And so, when I look at this issue, it's not a partisan issue. Mental health impacts everyone across the board. And so I want to thank Senator Eggman, and I do hope that these bills do make it their way through and get passed, as well as the care court. I believe that they go hand in hand with each other. And for those folks out there that think that any of these efforts are there to violate people's rights, they're wrong. It's not about violating rights. It's about saving lives. We love these people right where they're at. We're just not willing to leave them where they're at. Thank you. And it is my opportunity now to be able to introduce someone who has a history of being a champion for mental health. And I know he's gone through quite a bit in the last couple of days and has represented the city of Sacramento in a very, very professional way. And that is Mayor Darrell Steinberg. Darrell?
Thank you so much, Mayor Dyer. I really appreciate it. Really appreciate the opportunity to be with my fellow mayors. Although the terrible events in Sacramento may or may not be directly related to mental health. After all, nothing justifies people picking up weapons of mass destruction and killing and injuring people. I think it is a reminder to me that we are living in a very fragile moment in our society where the issues of mental health are becoming ever more prominent. And I hope that this is the time where mental health gets elevated from an issue that no one, frankly, would ever talk about or work on to an issue that dominates the legislative session appropriately as we try to fix what we know is broken. And in that light, I want to thank Senator Eggman for being a mental health champion. Because again, 20 years ago when I was in this field, actually longer than that now, oh my God, 24 years ago, when I started in the assembly, there are very few people who would take on these issues. And to see Senator Eggman put together a comprehensive package is both impressive and hopeful. And so I look at this package with a couple of comments. And I know that you wanted me to focus on the so-called Mental Health Services Act refresh, which I'm happy to do. The MHSA, as it is known, Prop 63, started out as a $700 million a year addition to Medicaid and the other public sources for counties and our communities back in 2006, its first year of implementation. This year, the Mental Health Services Act is projected to generate $3.8 billion, more money than ever before. And thank God for that, and for the voters approving the initiative. The initiative has been, despite some constructive criticism about implementation over the years, it has been a lifesaver. It has been a godsend. It has saved tens of thousands of lives. It has invested in more innovation and prevention and early intervention and full service partnerships than we've ever had the capacity to do before. And yet, because we have a county-based system, which is a good thing, without stronger state oversight, there is a tendency to both have a myriad of approaches to common problems, and at the same time, not have the ability to show the public what outcomes are actually being achieved. And so the MHSA refresh, and we call it refresh as opposed to reform, because it is an opportunity to look now a decade and a half, more than a decade and a half after its passage, and to say the state ought to set standards. The state ought to say that homelessness, criminal justice, suicide, academic performance, kids remaining in schools, and I'm just picking a couple of my favorite outcomes because there are others as well, ought to be the fulcrum of the act. And while we should not tell the counties how to do their work in working with the nonprofits, everyone should be driven towards those outcomes. And I think about the care courts proposal that the governor has made, which I think is a very interesting and exciting proposal. The first response goes, well, where's the money coming from? Well, one place where the money can come from is the $1 billion addition on the Mental Health Services Act from last year to this year. And to refresh the MHSA by saying we want to focus on those tent encampments, and we want to provide the mental health services to people at volume in those encampments. And we now have the opportunity to do that. And Senator Eggman's legislation will help us. One last comment about conservatorship, because I've been through these battles for a long time. It is long past time that we reform California's conservatorship laws. There's no question about it. And yet the challenge, and we have a great author, but the challenge has been and will be, when we improve those laws, can we also guarantee that we're going to actually get the effective services to the people who need them? And we have an opportunity to create new rights, a right to mental health care and treatment in this state in some form or fashion. Care courts may be one way, while we improve our conservatorship law. Rights and responsibilities, they go together. Nobody should be living on the street. Nobody should be living with untreated mental illness and suffering in the way people suffer. It's first on us as society and as government, and then yes, the individual has to say yes. And so I support this package, and I view it as a great sign of attention and hope. Let me turn it over to my friend, Mayor Locke Dawson.
Thank you, Mayor Steinberg. it's difficult to follow the Dean of Mental Health Reform in California, and we have much to thank Mayor Steinberg for, but we also have much to thank Senator Eggman for, and my big city mayors. And perhaps those on the call who are watching or listening today don't realize that the big city mayors are actually a bipartisan group. We come from all walks, and yet this is one issue we are absolutely, united on. So I want to thank Senator Eggman, for bringing this legislative package forward. It's going to modernize. My fellow mayors have commented on this already, our behavioral health care continuum. And she knows what she's doing. I think this is something I can't emphasize enough. For those of you that may criticize or think this is political grandstanding, it isn't. I want to be clear. Senator Eggman has spent a career addressing mental health issues. She comes at this with experience, expertise, and passion. And I can say, as a 3-time gubernatorial appointee to the California Board of Behavioral Sciences and the former vice chair of the board, I have firsthand experience in setting, communicating, and enforcing standards for safe and competent mental health services. And this package does that. It's not a little here and a little there. She's actually done everything that we need to do to try to address and fix the broken parts of the system. It's a really holistic approach to strengthen specifically the local government's ability to assist those in crisis, as my fellow mayors have referred to. It's really time. It's really time for us to rethink and reform these old policies and laws. They're just not working in our cities. And I'm angry. I'm angry about it. I'm angry that, when I hear from people, you're not doing enough. You aren't fixing it. You're not helping people. We all want to so badly, but we are to some degree bound by limitations on what we can do. And I think Mayor Gloria said a lot about that, and I appreciate his comments on that. We want to help, and we are often unable to do so. People who were in mental health crisis lack the capacity often to accept services. It's not just that they're refusing them, they don't have the ability to accept them. So, and I've said this before, and I mean it. We don't need to commit the sins of the past, but we're really decades past old models. We don't need to go backward, but we can move forward. So fortunately, Senator Eggman's bill package offers significant reforms and gives us a new paradigm, and it allows us to care for our most vulnerable populations. And we have a moral imperative to do so. It's shameful to see what's happening on our streets. And to Mayor Dyer's point, this isn't infringement on liberties, because the folks we see there are actually in shackles, and we need to help them be free of those shackles. So I just feel we really have a moral imperative to do so. So the time is now, and as a big city mayor, I emphatically offer my full support of these bills. And I want to thank everybody for listening this morning. And I want to turn it over to Dr. Binder, Professor of Psychiatry at UC San Francisco. Thank you.
Thank you. And I support these bills that have been introduced by Senator Eggman as a means of keeping people with mental illness from winding up in the criminal justice system. So let me tell you a story that's all too common. In my role as a clinical psychiatrist, I was consulted by a father about his son who was diagnosed with schizophrenia paranoid type about 5 years earlier. And the father had been unable to get sustained coordinated treatment for his son. The son was in and out of psychiatric hospitals, and it was often preceded by long stays in emergency rooms waiting for an available bed. The son refused to take medications. His mental status continued to deteriorate to the point where he refused housing and lived on the street. And I tried to help the father access resources, get the son engaged in treatment. But in the meantime, The son wound up getting into a physical fight with another homeless person and was arrested. And as a forensic psychiatrist, I see the consequences of having people with serious mental illness being incarcerated. People with serious mental illness do not belong in the criminal justice system. When incarcerated, they're often victimized, and they serve longer sentences than others convicted for the same offense. Partially because they may continue to get infractions because they just don't understand all the rules and regulations that go on in an incarcerated system. And here's some data. 15 to 20% of people incarcerated in jails or prisons have serious mental illness. There are 10% more people with serious mental illness behind bars than in psychiatric hospitals. So if we think about that, for every person who's in a state mental hospital, 10 similar people are behind bars. And if we include substance use disorders, 40 to 60% of people who are incarcerated meet the criteria for drug abuse or drug dependence. So the purpose of these bills introduced by Senator Eggman is to facilitate psychiatric treatment for people who need it before they commit crimes or are incarcerated. And the purpose is to get people into treatment early and also to have accountability for providing services to needy individuals. And now I'd like to introduce Dr. Lauren Scher.
Thank you, Dr. Binder. So I would also like to start by thanking Senator Eggman for your outstanding leadership and support to modernize the mental health system here in California. I also want to thank the Big City Mayor Coalition for your strong support for these bills. So like Dr. Binder, I'm a physician and psychiatrist, and I've worked for over 12 years in the emergency department setting, inpatient hospital settings, and also in primary care. So our patients are suffering from, suffering from severe mental illness and mental health crises, like Dr. Binder said, are waiting for days in emergency departments for much needed treatment in psychiatric settings. They have a variety of mental health conditions, including suicidal depression, schizophrenia, post-traumatic stress disorder, and substance use disorders. It's important for us to remember that these are treatable medical conditions like diabetes, cardiovascular disease, and asthma, which all require acute stabilization and coordination of care back to the outpatient setting. So psychiatrists and the mental health community support these bills to improve the mental health continuum of care. We particularly support the use of the continuous quality improvement model known as CQI. This data-driven approach would improve our management of complex illnesses that impact our patients, our families, and communities. For example, SB 1154, which was referenced earlier, would establish an internet-based dashboard to display real-time data for bed availability to psychiatric hospitals, crisis stabilization units, residential facilities, and licensed facilities for substance use disorders. Early intervention in psychiatric crises is critical, and faster access to acute and subacute facilities will improve recovery time and shorten length of stays. During this pandemic, just as we use patient flow dashboards to find available ICU beds for our patients with COVID-19, we should employ the same systematic data-driven approach for patients suffering from these high-risk and often deadly conditions. It's important to remember that 10% of people diagnosed with schizophrenia commit suicide, and that suicide is a leading cause of death in this country and state. People don't realize that suicide deaths are more common than deaths from motor vehicle accidents, and suicides outnumber homicides by 3 to 2 in the United States. So at least as was mentioned before, at least 1/3 of California's homeless suffer from severe mental illness. Homelessness and housing insecurity, just like food insecurity and poverty, are social influencers of health that make it more difficult for unhoused individuals to seek and receive adequate care. So we must provide holistic support to meet these fundamental human needs of nutrition and shelter. So these bills to modernize the mental health system are a step in the right direction, a big step, thanks to Senator Eggman and her leadership, especially for acute care. We also support linking these initiatives to the CalAIM program to expand the mental health workforce, to systematically integrate mental health services into primary care settings, and to improve screening and prevention initiatives to prevent crises before they occur. So these steps will also help to decrease mental health stigma, which prevents many Californians from seeking care. So thank you for your attention, and it's my pleasure to give the floor back to Senator Eggman.
Thank you very much. And thank you everybody for your comments, and thank you for your kind words about me, but it's really not about me, right? It's about all of us and having every tool available to be able to address the issues that we see facing us today. So thank you all very much. And now we'll take questions from the press if there are any questions.
I think we've got a question from Sigrid.
Morning, Sigrid.
Good morning. Historically, the legislature has only been able to pass incremental changes in Letterman-Pepper Short over the last 2 years. It's certainly getting more attention, more bipartisan attention than it has in the past. But what do you think are the opportunities and the likelihood that we'll see major changes in LPS this year, and how, over the long run, do you think a ballot measure will be necessary? You've talked about that in the past, Senator Eggman. Or do you think we're at the crossroads where something will actually be done?
Thank you very much for your question. I'm a social worker, so I'm an eternal optimist, and I couldn't believe that we all don't have the capacity to change and evolve, or I couldn't be a social worker or a politician, I will say. So yes, I believe this is the year to get it done. I think as you see, there's enough, professionals are all saying the same thing. The big city mayors are all saying the same thing. It's a large coalition, healthcare professionals. So I think this is the year to get it done. And you're right, if this is not the year that we can't get it all done, there is still a possibility of a ballot initiative further on. But I have a lot of hope in our process, and the strength of this coalition. I know as people said, it's not just my 8-bill package. There's a lot of interest in the legislature this year to do something. It is a bipartisan issue. So I am very hopeful that we'll be able to move and again, we're not just looking at LPS conservatorship by itself, but we're strengthening the entire system. And that's been one of the things that people point to. You can't take away somebody's rights if you don't have the supports in place to be able to provide for their needs. And we think we do, right? As Mayor Steinberg pointed out, the MHSA is getting billions more dollars. The amount of money, the historic amount the state has invested and will continue to invest. And CalAIM, as somebody else mentioned. So all the pieces are coming together right now to be able to do this, that it is not in isolation. It is not a silo. It's a comprehensive package that will work well, I think, across the system.
What about opposition? Just one more question from particularly from disability rights groups, which has been consistent throughout the years, and also some considerable resistance from the counties. We haven't talked much about the care court proposal, but that's the sanctions against counties would be a stumbling block for the counties, but certainly many say necessary for accountability.
We are having conversations with all stakeholders, and we'll continue to engage in those conversations. Again, as a social worker, one of my biggest thing is the right to self-determination. So it is not about taking people's rights away out of hand. This is about improving the quality of people's lives and providing them care sometimes when they do not have the ability to do it on their own.
Thank you.
Next question is from Dan Moraine.
Thank you. Senator, one of the issues long has been a lack of psychiatric beds, including beds in IMDs, locked wards. Do you believe that we need additional beds, psychiatric beds specifically? And does your package deal with that in any way?
Thank you for that question, Dan. We sent down 4.3 billion. David, correct me if I'm wrong on that number. Money for infrastructure last year through the budget for counties, nonprofits, tribes to be able to use that money to invest in infrastructure. And I know a lot of those projects are going on right now. And we'll continue to be able to provide more of that this year. We're hoping the governor has proposed another big $2 billion for bridge funding before that brick and mortar can all be built, to be able to have some mobile, small homes, whatever it may look like. And the administration, and we are fully supportive, continues to explore the IMD waiver. So we're hoping that will be another tool to be able to support the system as well. We always need more. And as Dr. Bender pointed out, we also have a bill looking at an online bed registry. That's another thing that we don't quite have enough information about. I have shared, back in the late 80s and early 90s, I was out 5150ing people in crisis and still using a tablet of paper to find phone numbers to call to see if there was a bed across town and who that bed was available for. We think, we've been able to do so much with technology. We're California, for goodness sakes. We should be able to have an online, on-time database that will quickly tell people where there are beds available. Staff often spend, social workers, nurses spend hours, days trying to find somebody a space oftentimes. So yes, we need more, but we also need to know where they are in real time. And we think the bed registry is going to be a way to be able to identify where they are, and also will tell us about the gaps of where we need more.
Next question is from Lisa Halverstedt.
First off, thank you, Dan, because he asked the exact question that I had as well. I guess I would just ask if some of the mayors could elaborate on that question, in particular, San Diego Mayor Todd Gloria. Is there a sense of how this legislation or other reforms might bring more beds to bear? And what is the thought on specifically what types of beds are needed in the community to make all of this work?
Happy to try and field that, and Senator and my colleagues are please feel free to chime in as well. Yes, we need more beds. I think Senator Eggman correctly identifies our existing resources and are we utilizing them to their full extent. At least I think you are very familiar with my efforts here to make sure that every bed that we have in our shelter system is put to good use. I think this is similar, obviously with a higher level of care, a similar concept. But beyond that, we do need more resources. And I think that Mayor Steinberg has been very observant in pointing out the extreme growth in MHSA funding and being able to leverage that growth to create the beds that we need to be able to make these laws effective. Folks need a place to go. I get that. The 72-hour hold is often not that, right? It's usually something quite less than that, and that's a capacity issue. And so we need to address that. And I think maybe a follow-on question would be, well, where you put those? Obviously neighborhood opposition can often be a real issue. But Lisa, you well know what neighborhoods are already dealing with in terms of folks living on our streets, our sidewalks, our canyons, our beaches. This is a far more preferable situation than what we're currently experiencing with people who are severely ill, left to roam about the neighborhood. So I'm hopeful that this legislation will leverage the opportunity of these large amount of dollars that are currently available to create the beds, and then leave it to us and hold us accountable for actually constructing those facilities in our communities. Again, I would say to any San Diegan, this is preferable to what we're currently experiencing. And I also would suspect that with a little bit of research, you'd find that it'd also be substantially cheaper than our current approach.
And if I could add to that, we have a bill, SB 1238, as part of the 8-bill package that actually takes a regional approach to some of the housing issues. And you are correct. Some of the money that is coming down from the state will come with real, you have to have outcomes for it, or you're not going to continue to get the money. And 1238 will use some like a cog where Council of Governments already get together, because as you've heard and are familiar with, the people yell at the cities and the mayors about the issues, but the counties are often responsible ones to provide that behavioral health support. So personally, I live in San Joaquin County, right? So Stockton is the biggest city there with the most concentrated issues. And yet some of the smaller cities don't feel like they quite have a place at the table when we're talking about bed expansion. And so it needs to be done from a regional perspective. And I think that will also continue to break down some of the silos. It's not just looking at the cities or the counties, it's looking at the whole region and how they work together to be able to establish some more bed space. We have an example in between Stanislaus and San Joaquin County, where they're going in together to build a facility to be able to help folks.
And Senator Eggman, could I just add as well? I think you know about Senator Roth's proposed bill 1143, which is to establish a revolving loan fund to build acute psychiatric care facilities. So this is in acknowledgement that I see it as sort of the exclamation point or the icing on the cake to the suite of bills that, okay, now we've got folks, now we've got a funding source that the counties can tap into to build more facilities. So that's moving forward as well.
And again, if you monetize things, if we provide the funding for it, communities and nonprofits will step up. We've seen that over and over with dialysis or hospice or things like that. If there is a reimbursement stream, agencies will come up to the plate to be able to provide the services.
And Lisa, did you have another question or shall we go to Dan?
You can go to Dan. Thank you very much.
Dan Moran.
I'm sorry, my question was asked and answered. Well, thank you.
Okay. That then I think is all the questions that we have, Susan.
Okay. So thank you all who tuned in today. Thank all the mayors, the doctors for being here with us today. This is one more step and let's go forward together. Thank you all very much.
Thank you, Senator.